Bismillahirrahmanirrahim. Hello everybody. A 16-year-old girl is brought to the office because she has not started her menstrual period yet. The patient 14-year-old sister underwent menarche a few months ago and her mother began menstruating at age 13. The girl has not had any headache, change in vision, weight gain, nipple discharge or abdominal pain. She has no chronic medical condition and has not surgeries. The patient is not sexually active and is not on contraception. She plays basketball for her high school team. Height is at 85 percentile and weight is at 25 percentile for age. Vital signs are normal. Breast, axillary, and pubic hair development are sexual maturity rating. TNR stage 4. The abdomen is soft, non-tender, and has no palpable masses. On pelvic examination, the external genitalia appear normal and the vagina ends in a blind pouch. Pelvic ultrasound revealed bilateral ovaries but no uterus or cervix. Which of the following is the most likely diagnosis of this patient? Androgen insensitivity syndrome, constitutional delay of puberty, functional hypothalamic amenorrhea, imperforate hymen, Mullerian agenesis, transverse vaginal septum, Turner syndrome. So this patient is a 16-year-old girl which is brought to the office because she had not started her menstrual period yet. Breast, axillary, and pubic hair development are maturity rating, which is TNR stage 4. On pelvic examination, which revealed the external genitalia appear normal and vagina ends in a blind pouch. Pelvic ultrasound revealed bilateral ovaries but no uterus or cervix. So based on these hints, the diagnosis of this question is Mullerian agenesis, which is also known as Meyer-Rokitansky-Hauser syndrome. So why? Here the correct option is choice E, Mullerian agenesis. This patient primary amenorrhea, normal secondary sexual characteristic and absent uterus are consistent with Mullerian agenesis. During development, the Mullerian, which is the paramesonephric duct, develop into the uterus, cervix and upper one-third of the vagina. Patients with agenesis do not develop these structure and so have amenorrhea due to the association with renal development. Patients with Mullerian agenesis may have renal system abnormalities, for example, duplicated ureter, that require evaluation for that is renal ultrasound. Treatment of Mullerian agenesis include vaginal dilation to create a functional vagina for sexual intercourse. Come to the incorrect one. Androgen insensitivity syndrome. So androgen insensitivity syndrome occur in genotypically male who have defective androgen receptor function. These patients appear phenotypically female and have primary amenorrhea, tall stature, and an absent uterus. Choice B, constitutional delay of puberty. So constitutional delay of puberty is a delay in theilerarchy, which is breast development, adrenarchy, which is a pubic and axillary hair development, and menarche in a patient with a uterus. Choice C, functional hypothalamic amenorrhea. So functional hypothalamic amenorrhea can present in athletes with primary amenorrhea. Choice D and E. I will explain both the choice D and F together, which is imperforate hymen and transverse vaginal septum. So a patient with imperforate hymen or transverse vaginal septum may have primary amenorrhea. However, both are isolated genital outflow tract defect and a patient who have a uterus. Turner syndrome. So patient with Turner syndrome can have primary amenorrhea due to decreased ovarian function, and patient typically have short stature and minimal breast development, which are not seen in this patient.